Good afternoon, everyone, and thank you for joining me for our weekly update. I'm very pleased, as always, to be joined by Dr. Lawrence Lowe, Peel's Medical Officer of Health, Sam Rogers, Mississauga's Director of Enforcement, who is joining us virtually for any questions you may have about enforcement, and Darren Rizzi, our Fire Chief and Director of Emergency Management. Before I give my COVID update, I want to briefly touch on the new gun control legislation that the federal government tabled yesterday. I certainly welcome any measures that strengthens Canada's gun smuggling and trafficking laws and additional funding for community youth programs in our cities. I was, however, disappointed that the government didn't put forward a nationwide handgun ban, instead choosing to give municipalities the authority to ban handguns in their individual cities. The biggest issue, as you know, is that guns don't care about municipal boundaries and borders are porous. Guns simply flow to wherever there is a demand. If we put a handgun ban in Mississauga, it would be largely symbolic if neighboring cities didn't implement one as well. I think the best way to eradicate gun violence in our cities is continued investment in youth, stronger penalties for gun smuggling and possession of illegal guns, and of course, a handgun ban across the entire country. I have advocated for a nationwide handgun ban since 2019 when the federal government put forward previous gun legislation. I simply don't believe anyone in Canada needs a handgun, and I think many Canadians would agree with me on this. COVID cases in Peel region and in Mississauga continue to steadily decline. Peel is now averaging 102 cases per 100,000, down from 123 cases per 100,000 last week. Mississauga is averaging 81 cases per 100,000, and that's down from 103 cases last week. That is incredible progress. I'm so proud. A month ago, Mississauga was averaging 211 cases per 100,000, so you see it's quite a significant decline. Let that sink in for how much progress we have made in just a month's time. We've seen a 65% of decline in our case numbers. This is proof that the stay-at-home order has worked and that people across Ontario and particularly across Mississauga have listened to the advice of public health. Thank you again for playing your part in doing the right thing. Trillium CEO Michelle D'Emmanuel told me that while our hospitals are in a fragile state, they are holding their own. Trillium is currently dealing with 51 COVID hospitalizations, 15 patients in the ICU, and another 123 suspected cases of COVID. Brampton's William Osler Hospital currently has 39 COVID hospitalizations, 8 in the ICU, and 24 suspected cases. In Peel, there are 13 long-term care homes, 7 retirement homes, and 10 group homes and assisted living facilities that are in active outbreak. But we continue to head in the right direction, and I'm very hopeful that over the coming weeks, our case numbers are going to continue to decline. We have been preparing Mississauga to move into the grey zone in the province's color-coded framework on February 22nd, as the Premier outlined last week. And I know that a lot of small retailers have been ramping up to get back to in-person shopping as the grey zone allows for 25% store capacity. Our Medical Officer of Health, Dr. Lowe, however, has some serious reservations about going into grey on the 22nd and has made recommendations to the province on how we should move forward. I'll let Dr. Lowe explain his recommendations, but I do understand his concerns. Peel has seen a dramatic increase in the number of variant cases, which, as we all know, are more transmissible. Many of you probably saw that over the long weekend, a condominium in the downtown of Mississauga had 8 COVID cases, 5 of which were B1351, the variant originally reported in South Africa. Peel Public Health was on site on Monday and tested over 500 people in the condo and left messages for those who were not home to go out and get tested. What's particularly troubling is that the 5 people who tested positive for the variants were not known to each other and had no history of travel. We now have 45 confirmed variant cases in Peel and more than 200 that have been screened as potential variants but have not yet been identified. And while this is a small percentage of our total case counts, as we've seen in Europe, in those cities, just how quickly things can get out of hand. Kids in Peel have just gone back to in-class learning today, so it will be another 7 to 14 days until we can assess the impact school reopenings will have on our rates of transmission. I do want to make something very clear. I want Mississauga to move into the grey zone on February 22nd, but I will support Dr. Lowe's recommendations. I've trusted Dr. Lowe's professional opinion throughout this pandemic, and I trust him now. We've always said that we would take the advice of our medical officers of health. His recommendations have always been in the best interests and the safety and well-being of all Mississauga residents. My priority is for a safe reopening, one where we can ensure that schools remain open, hospitals maintain capacity, and when small businesses do open, they can stay open. So I want to shift a bit and talk a little bit about our vaccine rollout here in Peel. While we've seen delays over the last few weeks with the vaccine shipments, I was very encouraged that the single largest delivery of the Pfizer doses arrived in Canada earlier this week, and next week the federal government is expecting an even larger shipment. The country is back on track, and we're on track to receive 6 million doses of Moderna and Pfizer by the end of March. And we have been assured vaccine deliveries will ramp up even further in April. We've also ramped up our efforts here with 2 community vaccination clinics set to open later this month. One is at 7120 here Ontario Street in Mississauga, and the other one at 10 Peel Centre Drive in Brampton. We have also finalized more clinics, including a mass vaccination site at Paramount Fine Foods Centre. As Peel receives more vaccines, adults 80 and over will be among the first groups prioritized. So too will be staff, residents and caregivers in retirement homes and other congregate care settings, all Indigenous adults, and adults who receive home care for chronic illnesses. If the federal government continues to deliver supplies, we will begin vaccinating adults ages 50 to 79 in April at our community vaccination centres and pharmacies, along with adults with chronic health conditions and other essential workers. By August, the rest of our residents should be able to access the vaccine. Mississauga, there is end in sight. I know it's been an incredibly long year, but please hang in there just a while longer. Before I bring up Dr. Lowe, I just want to talk a little bit about a conversation I had last week with the Prime Minister and other federal ministers as part of the Big City Mayors Caucus. We were able to touch base about the historic announcement that will see the federal government investing $15 billion over the next 8 years into public transit. I also had the chance to reiterate how important it is for municipalities like Mississauga to receive support as we work towards recovery. Because our advocacy efforts last year, the federal and the provincial governments provided substantial support to Mississauga to offset deficits due to the massive decline in My Way riders and use of our recreational facilities. And I made it very clear how critical additional support will be for us over the next year in order for us to maintain the services residents and businesses have come to expect from us. I also had the chance to speak directly with the Deputy Prime Minister, Chrystia Freeland, who is also the Finance Minister, of course, about the paid sick leave issue. I explained that my main concern is that the federal government's sick benefit requires people to apply for it after they have become sick or have to isolate. This is a very big issue because many workers are deciding to go to work sick because they don't want to see an interruption in their wages. The Canada Recovery Sickness Benefit also provides less than $500 a week. It's actually $450 net, less than a full-time minimum wage earner would earn, and hardly enough to support a family in the GTA. If we truly want to stop the spread of workplace outbreaks, we need to incentivize the workers to isolate, to stay home and recover. This means a sick pay program that immediately provides workers with adequate wages. I strongly believe that the best solution is for the province to mandate 10 paid sick days throughout the pandemic, with the federal government providing financial support to employers to cover the costs. We can backstop those employers. Almost every single day, we see a new op-ed in the Toronto Star or the Globe and Mail or from other prominent newspaper from doctors, community leaders, or health experts saying the exact same thing. Let's just get this done, folks. With sectors of our economy now beginning to reopen, it is more important than ever that we see action on this. And now, I'd like to invite up Dr. Lowe to provide his update, please.
Thank you, Madam Mayor. Good afternoon. Mississauga's test positivity for COVID-19 currently sits at 4.6%, which is down from 5.7% last week, with a weekly incidence rate of 81.3 cases per 100,000, down from 103 per 100,000 last week. While favorable, we are seeing that our trend is being driven by two different patterns that are going in vastly opposite directions. The original strains of COVID are going down, which is good, but the variant strains are accelerating in growth, and those two trends are canceling each other out. In the region of Peel, we have seen our variants of concern go from 5 cases to 45 confirmed cases in 1 week, and there are 200 more people that have just screened positive for a variant of concern, and we are waiting confirmation for a test that is fairly sensitive. As our hospitals still remain fragile, as Mayor Crombie mentioned, this rapid growth is alarming. Our recent investigation at a Mississauga condominium in response to a cluster of B1351 gives us some insight as to how contagious these new variants are. Our investigation has identified that transmission may have been driven not by traditional close contact interactions. Rather, proximity in common elements such as corridors or elevators driven over mere minutes. That concerns me. And what also concerns me deeply is that this is only one of several clusters of variants of concern that we are investigating in the region of Peel. And while I'm unable to share any details at this time due to the other active investigations that are continuing, I share generally to show that another storm is brewing. We know that with schools now having resumed in-person learning, with additional precautions in place, those enhanced measures will keep limiting spread in those settings and hopefully keep our students in school. But those strong precautions aren't necessarily being taken everywhere else, including some of the sectors that might be contemplated for reopening. And ultimately, we know that our best defense for our children and teachers in schools, for our vulnerable, and to avoid the case, hospitalization, intensive care, deaths cascade is to continue to keep community transmission and the variants of concern low. There is hope, as Madam Mayor has identified. The province has advised that more vaccine is coming. We will soon restart vaccination for our healthcare workers at highest risk, and I'm also excited that allocation is also slated to come for our seniors over 80. We know that they have been patient, and once this vaccine arrives in the coming weeks, We will work with partners to get this out as quickly as possible. As vaccines arrive and variants thrive, though, I wonder if we should rethink our next steps. I would not be meeting my mandate if I did not clearly sound the alarm on the further loosening of measures and reopening too soon, especially with variants accelerating in our midst. In so saying, please know I recognize how difficult and hard this past year has been. I feel for everyone that has been impacted. But I ask a simple question. Can we hold on for just 2 weeks more so that we can be sure that we'll keep our kids in school for longer, continue to protect our vulnerable, and continue to protect our essential workers as vaccine arrives? I know another 2-week delay is not what people want to hear. I know we're all tired, but experience from other jurisdictions in Western Europe and in Newfoundland most recently are instructive. In St. John's, explosive growth of the variant shut down their province within hours. And if you scale their worst day to the community of our size, Peel would have seen 1,300 cases in a single day. For this reason, I have written a letter with Dr. Eileen Davila in the City of Toronto to Dr. David Williams, asking to pause any return to the provincial reopening framework until the 9th of March. This is one of two paths forward. Can we please give our impacted businesses more support to hold on for just another 14 days while we revisit the broader provincial framework? I specifically ask for this because we also know that spillover to neighboring regions will also continue to drive risk here in Peel for our residents who may choose to go. If we are to enter the less restrictive provincial framework next week, then the other path forward is we must absolutely resolve our essential worker transmission challenge. Essential work remains a major driver of our cases in Peel, and our essential workers deserve nothing less than efforts around inspection blitzes, rapid tests, and paid sick days to keep them safe if we are to move forward. The variants are spreading, and stopping them may well be impossible, but let's at least slow them for a little while longer until more vaccine is available. We cannot afford a third wave and lockdown. Our kids can't, our businesses can't, our most vulnerable especially can't. With that, I will thank you, and I'll pass it back to Madam Mayor.
Thank you, Dr. Lowe. And now, Dr. Lowe, myself, Darren Rizzi, our fire chief, and Sam Rogers, our director of enforcement, are ready for your questions.
Your first question comes from Jackie Crandalls at CP24. Go ahead, Jackie.
Hi, thanks so much. My question is for Dr. Lowe.
Sure. I'll invite him up. Oh, sorry, Dr. Lowe. Sorry.
Thanks, Jackie. Go ahead with your question, please.
Thanks, Dr. Lowe. The variants of concern, obviously, the big driver behind your joint request with Dr. Eileen Davila to extend the stay-at-home order in Peel Region and in Toronto. Looking at the numbers of the variants of concern specifically, Peel's numbers are very similar to those of York Region, both those variants of concern that have been confirmed and those that still need to be confirmed. That region's medical officer of health requesting that they go into the red tier. Does that concern you? Do you think that given the proximity to Peel, that that's a mistake?
So Jackie, certainly Dr. Kurji is best placed to speak for the transmission levels that he sees in his community. For my part, in addition to the variants of concern, we know that we still have the highest rates of transmission in the province. And certainly while they are favorable, as I mentioned, we're seeing the traditional variants being quickly replaced by variants of concern that are accelerating in growth. And certainly some of that is related to screening, but we also know that screening alone can't necessarily explain why we're going from 5 to 45 to potentially over 200 in a matter of days and weeks. I think that certainly is cause for concern, at least here in the region of Peel, with our transmission rates still being where they are. Thanks for the question.
Follow-up?
Yeah, I'm just wondering, because we know that, Toronto, Peel, and York, sorry, Dr. Lowe, this is for you as well, because you've been considered the hot zones, did you try to get Dr. Kurji on board with this letter to Dr. David Williams?
So thank you, Jackie, for the question. Certainly, we've been involved in many conversations with our colleagues throughout the province, and also have had many productive conversations with Dr. Williams. There certainly is a difference in perspectives around the way forward, but I am heartened by the fact that we all do share a similar goal, which is really ultimately protecting the health and well-being of Ontarians. I ultimately speak for the region of Peel, and was therefore able to put forward my recommendation. I understand that Dr. Davila shared the same view, and I expect that Dr. Williams, in his role in considering the whole province of Ontario, which is a large and diverse province, that he will render a decision that will hopefully keep residents across Ontario, but also, from my perspective, for my residents here in the region of Peel, to keep them safe. Thank you very much for the question.
Next question, please.
Your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Hi, Mayor Crombie. How are you?
I'm very well, Steve. How about you?
I'm good. Just a kind of a two-parter for you. You said you'd support Dr. Lowe's recommendations here, and that would mean kind of potentially a broader business reopening on March 9th. But first, can you, I know there has been a contentious issue on that kind of border with businesses between Mississauga and Halton region. So I guess, is there any kind of lessons learned that you would, that you would kind of apply to this to maybe calm the situation down both on council and with businesses based on kind of previous situations where Halton has been opened earlier than Mississauga businesses have?
Yeah, it's a good question, Steve. So I was so hoping we would be reopening on the 22nd. We've done such a great job. We're now at 80 cases per 100,000. The positivity rate, wait, let me get those numbers for you, is only 4.6%, and our R factor is 0.84. We're doing so well, and I can see the goalpost, for goodness sakes, and I know that those numbers would be even lower next week. However, Dr. Lowe has raised some very important concerns. Those new variants, which we seem to be a little bit of a hub here for the new variants, are dramatically growing, and they're growing quickly. They're extremely transmissible. If we put the brakes on and watch what happens with the kids in school for a few more days, if another few weeks, the weather will be nicer, the vaccines will have arrived, and we will have stabilized, and maybe instead of gray zone, we'll go into the red zone. So, I feel for those businesses and the restaurants, the retailers that are particularly on the border with Oakville. They're, Dundas Street in Mississauga is right on that border with Oakville, and that is really tough for them to watch their business going across the street, in fact. So I was hoping we were opening, but we have always said we'll be guided by the advice of Peel Public Health, and that's what we have to do. Dr. Lowe has significant concerns. I understand Dr. Eileen Davila in Toronto has significant concerns. John Tory is supporting her position. It just gives us a little bit of extra time, and if nothing else, there would be a good chance if we opened on the 22nd, we would turn around and close again the end of March or early April, and this may just avoid that reopening and closing back down. So I'm extremely disappointed, and I know our small businesses are hurting, and I know they were ramping up and looking forward to the 22nd, but I'm going to make a case that 2 weeks from today is actually the 3rd, not the 9th, Steve, so I'm going to push Dr. Lowe to move it up a few days.
Follow-up question?
And perhaps for you and Dr. Lowe here, the province has kind of extended the stay-at-home order previously, but I guess there has been a bit of an issue with kind of the rules changing almost on the eve of a new reopening. So I guess in terms of the timing here, when would you prefer that an extension of some kind be announced, be allowed by the province? And I guess both from the business perspective and
correct.
For Dr. Lowe, if he can address this, when from a medical perspective the data would be clear that it's time to change the date for stay-at-home order to end.
Great. So we'll both answer. Thank you. So, of course, the retailers do need a few days to ramp up. They need to put all the proper protocols, the Ministry of Labour guidelines into place. They need to recall their staff. They need to get set up. So they do need a few days heads up, a few days warning. And so they're waiting with bated breath to hear what their fate will be, whether we open on the 22nd or, as Dr. Lowe recommends to the province, to hold off another 7 to 14 days. So I don't think a definite position has been made yet. We will hear from the province what their intention will be, whether they'll keep us closed, as Dr. Lowe recommends, or allow us to go into that gray zone on the 22nd. That final determination has not been made. So why don't I ask Dr. Lowe to come and speak to how much time is needed, or does he feel is needed, for the businesses and for a medical advice. Thank you.
Yeah, thank you, Madam Mayor. Thank you, Steve, for the question. During the reopening process, we are in constant communication with our provincial partners, and reassessments take place on a weekly basis. And so certainly the idea is that a reassessment will happen usually sometime in the middle of the week, and then with an aim to make sure that there is consistency in terms of announcements towards the end of the week for the beginning of the next week. That's been the process that's been followed. I imagine that will be what will happen regardless of where we end up on the 22nd. And just on the other piece that I wanted to highlight on your first question, I want to make very clear that I did not make this recommendation lightly. I myself have had friends who have lost jobs. I have seen friends whose businesses have been shuttered. I have family members who are impacted by this, by the ongoing closure. The reality is that in other places where measures were not taken to curtail contacts and economic activities, you actually see the exact same impacts. Many places where the virus has run amok, you actually see consumer confidence drop because there's fear. People aren't going out to eat in restaurants. People aren't going out because they don't want to catch COVID. And so certainly that's been borne out in data elsewhere. The U.S. economy contracted 3.5% in 2020, and here in Canada, our contraction was 5%, but certainly, almost certainly 5%, but much of it was related to the U.S.'s own contraction. So the reality is you can stay open, you can stay closed. Ultimately, there will still be that economic hit, and really what we should be doing in the midst of this disaster, whether it's Halton, whether it's Peel, the impacted businesses need to get every little bit, of support that they can to make it through, in the same way they would if this were an earthquake or a hurricane or any other disaster. So just putting that in there, because I absolutely understand the impacts that this has on business and certainly on the health of those proprietors as well. Thank you.
Next question, please.
Your next question comes from Ashley Newport at Mississauga. Go ahead, Ashley.
Hi, Mayor Crombie.
Welcome, Ashley.
Thank you. So my question is for you, and Dr. Lowe might want to weigh in as well. I'm not sure. It's about workplaces. I know you've been calling for sick pay for weeks and weeks now, and it doesn't seem to be progressing. But I know that others have said that rolling out rapid testing at workplaces could also be a good way to get outbreaks under control. So I just kind of wanted to know the status of that. Has rapid testing been rolled out at more essential workplaces in Mississauga and Peel in general? And is it making any sort of difference that you can see so far? I mean, we do see the numbers dropping, which could be a combination of things, but has rapid testing been used in workplaces? And if so, is it making a positive dent in the cases so far?
I think you're right that the three factors combined, as well as stay at home, are making a dent. So having only essential workers go into the workplace, everyone else work from home, the rapid testing, protocols being in place for safe reopenings, and then of course those mandated sick leave and sick pay benefits are very vital. They're absolutely critical to get into place. And I'm going to let Dr. Lowe respond to whether he sees the rapid testing being used other than at Canada Post and at Amazon, which are still the only two I'm aware of, Ashley. I'll pass it off to Dr. Lowe.
Yeah, thank you, Madam Mayor, and thank you, Ashley. Certainly the The rapid tests that were deployed in some of the recent workplace outbreaks, notably in some of Amazon's facilities in Canada Post, the results of those are being evaluated, and our initial suggestion seems to be that they've had some benefit in assisting case finding. It's for that reason rapid tests, or just broader testing in general, is also being deployed around the school reopening as well, just to really provide parents and provide that additional protection and that additional level of protection to make sure that in the case of an outbreak or in high-risk communities that we're taking every measure to keep individuals safe. But as Mayor Crombie pointed out, it is one part of an overall strategy. So rapid tests alone won't stop things if people are showing up symptomatic and because they don't have paid sick days. So you need to have all of these things together to really protect our essential workforce. Thanks for the question.
Follow-up?
Yes, and my follow-up is with the lockdown in Mississauga potentially expanding into March and maybe even with restrictions expected to probably last into the spring, it seems like, even though no one can predict the future. How concerned are you about other big, you mentioned asking for more funding, more safe restart funding to help Mississauga cope with this, especially since it's lost so much revenue from transportation and other services. How concerned are you that other, big projects that the city's working on, like, you have some big community center redevelopments coming up. How concerned are you that COVID's going to delay or postpone these projects going forward?
So those projects you speak of, Ashley, are all funded through our capital plan and our proceeding. So those I'm not concerned about. We welcome the news of the $15 billion for transit. We have a number of projects we'd like to get off the ground, including our transit terminal in the downtown core, our BRT along Dundas, etc. Lots of projects we'd like to get off the ground. But certainly, you're quite right. There will be an echo effect with respect to our operational deficits. Certainly, My Way Transit is still operating at 40% or less. Our community centers, which we, of course, obtain revenue from for many of our programming, are still closed, etc. So we will be in deficit again this year. So we're quite hopeful that the Safe Restart program will be operating once again to give municipalities who need it the assistance with their operational deficits.
Your next question comes from Ziv Hattie at Zoomer Radio. Go ahead, Ziv. Ziv, are you there?
Yep. This is a question for Dr. Lowe.
No problem, Ziv. I'll bring him to the podium. Thank you.
Hi, Ziv. Go ahead.
Hi, thank you, Dr. Lowe. The Premier keeps saying that medical officers of health can extend lockdown themselves by invoking Section 22. So why don't they just do that?
It's a great question. It's one that I've contemplated. I've always tried to work very collaboratively with the province. I think we share a common goal, as I've said, in terms of protecting our communities and the people of Ontario. I think there's also a recognition that the variants of concern that have been identified here, are not necessarily a threat to Peel alone, but a threat to the entire province. I believe the outbreak in North Bay, which has been publicized, was also due to a variant of concern. So there is a recognition that our province is highly interconnected. There's a recognition that there is travel, as was described in a previous questioner, between regions, and ultimately an issue here would also present challenges in other jurisdictions. So to the extent that there is an interest on my part, on the interest of Dr. de Villa's part, to really make sure that there's a consistent approach across the province, that is our initial approach at this point in time. Thank you for the question.
Thank you very much, Dr. Lowe.
Follow-up, Ziv?
No, thank you.
Thank you, Ziv. Next question.
Your next question comes from Vanessa Ballantyne from The Pointer, and both are for Dr. Lowe, actually.
Perfect. Okay, we'll invite him up. Thank you.
Go ahead, Vanessa.
Hello, can you guys hear?
Yeah.
Okay, great. Can you hear me properly? Thank you.
Yes.
Okay, hi. So we know you're warning the province that we should delay reopening and going back into the colour framework, and that there are a few additional screening measures already that were put in place when it comes to returning to school. But by and large, for the general public, does the arrival of new variants in Peel trigger any changes or increased public health efforts, which may include additional provincial provincial assistance in preventing a third wave?
So I'm not quite sure. There were a few pieces in that question there, but something about additional provincial funding?
Just in general, like what are any new or increased public efforts that are coming to kind of address the new variants? I'm not sure just because you are... Okay, yeah, go ahead.
Yeah, so certainly we have continued to work with Public Health Ontario, which is the provincial agency that assists, in really looking at some of the new clusters that we've identified of these variants. I think there's a significant interest in really trying to be clear around how transmission may have occurred, how the cases and clusters are all related. We certainly, of course, continue to conduct extensive case and contact tracing on any variants of concern that we do receive, and so as that continues, depending on the nature of our efforts to contain these variants in our community, I would certainly imagine our collaboration with the province would continue, and if necessary, that appropriate resources would be given, depending on the direction that the province wishes to take in bringing these, under some form of control. Thanks for the question.
Dr. Lowe, the follow-up is for you as well. Go ahead.
Thanks. And so given that Peel is among the hardest hit regions in regards to COVID, and there was a delay in vaccines that really impacted us, is there a change in terms of delivering the vaccines to account for future unstable or inconsistent vaccine shipments?
I'm going to actually have Madam Mayor give her thoughts on this as well, but in terms of the vaccine distribution, we are very clearly an area that is in significant need, and so should there be additional vaccine that's available for deployment, my message is simple. If you're managing to address the issue here in Peel or in some of the harder hit municipalities throughout the Greater Toronto Area, the sooner we get things under control, hopefully that will bode well for the rest of the province as well. We've seen a consistent pattern of transmission, both within Ontario and then also in the national level. Many large jurisdictions have seen essentially it is the most populated international centres that get the worst hit and that are hit earliest, and then it spreads out to secondary centres, and then it spreads out to rural communities. That's the same pattern we saw in the United States. It started in New York and Seattle, and then moved into the south and moved into the southwest. It started in Canada, in Toronto and Vancouver and Montreal, and then moved into the prairies, and then now we're seeing it out in Newfoundland. And so to the extent that it should come as no surprise that we have more people and we are more connected to the global realm, or at least we were in the initial phases, we have been hit harder. We have had those pieces. That has really been one of the biggest drivers as to why our picture looks the way it does here in Peel. And to the extent that the vaccine can be distributed to account for that and our ongoing transmission, I certainly would welcome that ongoing discussion. So I don't know, Madam Mayor, if you wanted to comment on vaccine distribution.
Thank you for the question. I think Dr. Lowe has done a terrific job of responding. I think it will all balance out soon enough. As long as we start getting those needles in arms, as soon as the vaccine arrives, we'll get caught up pretty quickly. We do have 2 vaccine sites identified and we're ready to go, and we are ready to go. And then, of course, we have the mass immunization center at the Paramount Fine Food Center, and we're still looking for another central site and potentially even one in the south of the city. So we're ready to go as soon as we receive our shipment.
Your final question comes from Khalid Salama at My Second Home TV.
Welcome,
Go ahead,
Khalid. Welcome, Khalid.
Thank you. How are you? Thank you.
I'm very well. I hope you're well too.
Thank you. I'm trying. Thank you so much. Earlier this morning, there was an unfortunate incident in Toronto where a homeless person lost his life to a fire in his encampment. Chief Matthew Pegg, Toronto's fire chief, said this is the 25th incident and it is on the rise. How big is this issue here in Mississauga, Mayor?
Yeah, so thank you for the question, Khalid. We don't have the same kind of encampments here in Mississauga, to best of my knowledge. We do have a homeless problem, of course, but not those sorts of encampments. I'm going to ask our new fire chief if she has any additional information to respond to you as well, Khalid. Chief Rizzi.
Thank you. Thank you.
Good afternoon. So as Mayor Crombie indicated, we don't seem to have that issue right now in Mississauga. Some of the structures that are being built in the city of Toronto, the materials that they're built out of are highly flammable, and that's in terms of the material that's around it. And so right now we're not seeing that here in the city of Mississauga, but certainly it is an issue over in Toronto. And just keeping in mind, you can't build structures just in the middle of city anywhere you want to. There needs to be building permits to ensure the safety of those that are going to be living inside of any sort of building or structure that is built. So I will pass it back over to you, Mayor.
Thank you, Kat. Thank you,
Follow-up
Chief.
question?
Follow-up?
Madam Mayor, if I may ask Dr. Lowe as well?
Oh, absolutely. We'll call up Dr. Lowe. Thank you.
Thank you
Here
so
he
much.
comes. No problem.
Yes, Khaled, go ahead.
Dr. Lowe, we've been talking about infection and community spread, but what about the treatment for those who test positive? Is there a certain medication or treatment protocol, as other countries call it? And also, is it true that former President Trump got some rapid medication from Germany?
Yeah, thanks, Khaled. At this point in time, there's a number of different treatments that have been studied. I know the one that has had the most benefit so far has been a steroid treatment, dexamethasone specifically. But I think it's certainly the Trump, I shouldn't call it the Trump treatment, the treatment that President Trump received, I believe recent evidence has shown may not have the same effectiveness as was initially believed. I think what is positive, though, in respect of treatments is we do know that the vaccines are very effective, and that they do, largely at least the two products that have been approved in Canada, remain effective even against the variant strains at this point in time, based on indications of current data. So the hope would be, at least in considering my recommendation today, a couple more weeks gets us a little bit closer to more vaccine availability, warmer weather, and also a little bit of resolution to what's a very turbulent picture at this point in time. So treatments, vaccines, ultimately this will continue to progress, but we just need to hold on a little while longer with the distancing, the masking, and the staying at home as much as we can, regardless of what happens. Thanks for the question.
Next question, please.
That concludes our press conference. There are no more questions.
Thank you very much for joining us today.